You're listening to the ToeTalks podcast. What if I told you there may be an early treatment for chronic lymphocytic leukemia that can be implemented upon the day of diagnosis, day 1, or while undergoing oral chemotherapy treatment for CLL? What if I told you there's an early treatment that's safer than the oral chemotherapy that's currently being offered to patients? A treatment that may be even more effective than chemotherapy because it selectively kills cancer stem cells, leaving healthy cells alone, unlike chemotherapy. And unlike chemotherapy, there is zero risk of this treatment causing cancer. Today, we're going to talk about a non-chemotherapy based early offensive treatment protocol guide that was developed from a case report done on a patient diagnosed with blood cancer. Stick around, you're not going to want to miss it. We are the rugged, authentic savvy, and you're in the right place. Live free. Pursue health. Powerful living starts in 3, 2, 1. Welcome to episode 4 of the ToeTalks podcast. I'm your host, Dr. Toe. Early and synergistic chemotherapy guide to treating chronic lymphocytic leukemia. A new offensive and strategic protocol to put CLL on the run. Start treating at diagnosis and start winning. This guide was birthed out of desperation to find an alternative to chemotherapy and with the goal to not have to use chemotherapy any longer than necessary or at all. Today we're going to talk about the case report that this guide is based on, the patient that was involved in this case report, the treatment performed on this specific patient, and the outcomes, and in the end, the overall conclusion or implications and weight this guide carries. Let's talk about what a case report is. A case report is something that is written by a clinician in the healthcare field. It describes an unusual or novel occurrence that they have seen in an individual patient that is worth noting so that further research may springboard off this novel finding in order for further data to be gleaned. Case reports look a lot like research, but they're not. They can more accurately be described as pre-research. Usually the report, once written, is published in a medical journal, and this is where other researchers then get ideas for further clinical trials or further ways of gleaning data on that subject matter. Unfortunately, no medical journal would publish this particular case report for 2 reasons. One, I am not a medical doctor who prescribed the medication used in this patient's particular treatment. And 2, one of the 2 drugs used in this treatment protocol have not been approved by the FDA for use in humans. But I was not going to let that stop me. So I decided to publish the information myself. One way or another, I was going to get this information out to people. Where there's a will, there's a way, right? So I created a protocol and supported its positive effects on reducing CLL symptoms and tracked its safety through lab work, diagnostic testing, symptom analysis, and images. Let's move on to the patient. So the patient in this case report was a male in his 60s who was diagnosed with CLL and was already undergoing oral chemotherapy treatments. Shortly after starting this chemotherapy treatment, the 2 anti-parasitic drugs for this protocol were added to the patient's overall treatment regimen. Then 7 months later, the oral chemotherapy drug was stopped, but the antiparasitic drugs were continued. Now let's actually talk about the treatment protocol itself. This protocol can be used for early treatment, or it can be used alongside oral chemotherapy treatment. The two drugs that are used are fenbendazole and ivermectin. Both of these drugs are antiparasitic drugs. The fenbendazole is used 4 times a week, and ivermectin is used 1 time a week. They are done in a 5-day treatment. So fenbendazole 4 days in a row, ivermectin the next day, and then there is a 2-day break from these antiparasitic drugs. The protocol used 2 different types of, or 2 different forms of fenbendazole, and they were taken on alternating days. So there is a slow release form of fenbendazole that was taken on day 1 and day 3, and then a fast release powder of fenbendazole that was taken on day 2 and 4. And this powder has to be mixed with some sort of fat, and it was mixed with MCT coconut oil. And then on day 5, a prophylactic dose of ivermectin was taken. Ivermectin has been approved by the FDA for use in humans, and it has an incredible safety index, as it is safer than Advil or Tylenol, and taken by billions of people for over several decades. I want to stress to you that fenbendazole and ivermectin, you have to be careful about where these medications come from. We were very particular about our sources for both medications, making sure that they were in a reliable form from reliable sources. Not all fenbendazole or ivermectin are the same when it comes to how they are sold or produced. So if you can find it in the United States, that's the first thing I would look at. Neither one of these 2 drugs would I ever get on Amazon. That's just my opinion. So not only were these 2 drugs added to the treatment regimen when the patient was receiving oral chemotherapy treatment, but also supplements were taken alongside these antiparasitics, because there is research that talks about supplements making fenbendazole and ivermectin more bioavailable and therefore more effective. The supplements that were taken were vitamins A, K2, D3, E, zinc gluconate, magnesium with B6, high-dose vitamin C powder, curcumin, and probiotics. Along with these antiparasitic drugs and these supplements, the patient changed their diet. No processed sugar, eating greens as they come out of the earth, intermittent fasting, and a vegetarian diet when able. Now, he was on a vegetarian diet for a year, and he began to lose too much weight. I think this is part of the effect of the disease process, and also maybe even so the chemotherapy drug, that he had to start supplementing with meat in order to keep a healthy weight on him. But if you are able, I highly recommend going vegetarian for at least a short period of time. And the reason I say this is because of a book called Chris Beat Cancer. If you haven't read this or gotten this book as a resource, and you have somebody in your life who is struggling with cancer, or you yourself have cancer, I highly recommend you getting this book and reading. It's one of those books that can be overwhelming, where you read it and then you're like, I don't want to eat anything anymore. But I think because now Bobby Kennedy is going to be in charge with making America healthy again, we're going to see a major change in the food additives that are making us sick. And so when you read this book, and you will probably feel that way, that you're like, what can I eat? Everything's bad. No, well, it's really not, but there is a retraining that needs to happen. And so it's about improving your diet slowly. Don't go from 0 to 60 with that. If you're a spouse, you're going to make your other spouse crazy. Or if you have a family, you've got to slowly incorporate things, slowly take away things. That's my advice for that. I really do believe that a diet change is incredibly important, because I am now of the camp that believes that cancer is largely a metabolic issue, and your immunity starts in the gut. So you've got to take care of yourself by taking care of or being careful about what you put in your mouth, especially processed foods and foods high in processed sugar. And that's the treatment protocol. That's the treatment protocol that was used while he was on oral chemotherapy, and what he has continued to do after the oral chemotherapy drug was discontinued. Come this January 2025, the patient will have been on this protocol for 2 years with significantly improved blood levels, no disease progression or symptoms from CLL, few episodes of sickness demonstrating an improved immune system, 0 hospitalizations, and no ill effects from the treatments themselves. I also think it's worth noting that when the patient did get sick, we used the ebook that I wrote called Kicking the Viral Load. We used the protocol in there in order to boost his immune system and in efforts to shorten the lifespan of the sickness or the virus that was attacking him. If you're interested in that ebook, you can get it for free at www.drtoe.com. Now let's look at the outcomes to this protocol, or the outcomes that were found through writing this case report. While on this treatment during oral chemotherapy treatment, the patient was able to achieve progression-free symptom status in 7 months during the use of chemotherapy, where most patients it takes 18 to 24 months while on the specific oral chemotherapy drug Brukinsa. While on this protocol, the patient will have maintained this progression-free symptom status for 22 months come January 2025 without the use of oral chemotherapy drugs, where most people who are on Brukinsa will have had to be on the chemotherapy drug for 34 months in order to enjoy progression-free symptom status for only 12 to 18 months, and then be switched to another chemotherapy drug to continue treatment, because relapse typically occurs, meaning they become drug resistant. The drug stops working, and then symptoms begin to progress again for CLL. This fact is very important to note, because this successful treatment progression is rare. It's not documented in the body of research. I didn't find it anywhere. In addition, the patient suffered no side effects from the antiparasitic drug regimen. No liver or kidney toxicity issues were experienced with long-term use of these drugs. This patient is still on these 2 medications to date. And part of the reason why fenbendazole has not been approved by the FDA is supposedly because of drug toxicity issues to the kidney or liver. I didn't see this at all with this protocol. And research is proving that this is really not a valid concern anymore. The other benefit about this protocol is this patient was being followed by an oncologist, and at least once a month was having blood work done, and kidney and liver levels were always checked, no matter what, whether he was on chemotherapy or not. So we have an incredibly good baseline prior to him starting chemotherapy treatment, and not once did any of his levels, including electrolytes, change. They were always within normal limits. Let's continue on with the outcomes, and let's talk about the safety and cost of fenbendazole and ivermectin compared to Brukinsa. It's significant. These drugs, the antiparasitics, are pennies on the dollar compared to Brukinsa, which is $500 per pill, with most patients taking 2 to 4 pills a day. Wow, talk about price gouging. I mean, seriously, $500 a pill times 4, $2,000 a day. Really, how much does it really cost to make this drug? I really wonder. Seriously, are these drugs made of gold? I digress. Fenbendazole and ivermectin also do not cause cancer and selectively target and kill cancer stem cells, leaving healthy cells alone, unlike chemotherapy. This treatment also successfully improved overall blood level ranges and helped maintain either normal or near to normal blood levels. Now let's get into the overall conclusions that can be made from the use of this early offensive CLL treatment protocol. 1, it can be used as an early treatment upon diagnosis of CLL day 1. 2, it can be used synergistically alongside oral chemotherapy, such as Brukinsa, to expediate getting the patient to progression-free symptom status. 3, patients need less chemotherapy treatment to achieve progression-free symptom status. 4, patients may be able to maintain progression-free symptom status for extended periods of time without the need or use of oral chemotherapy drugs. 5, there's less cost, less drug intervention, risk of side effects, risk of other types of cancer, or relapse with this protocol. So now we get to the question of, so what? So what, Dr. Toe? So what about this protocol? Well, folks, from where I sit, I don't see too many negatives to this treatment, but you need to be sure that you research everything. Do not take my word for it. You need to look to see for yourself. One way you can do that is by getting this CLL protocol guide. You can purchase it at www.drtoe.com. And when you do, you will support this podcast to help keep me on the air and help me spread this information to others that might just find it helpful, maybe even life-saving. Dr. Toe, what exactly is in this protocol guide that you've put together? It talks about how the protocol came into being, the research behind ivermectin and fenbendazole, how it can be used for early treatment, and synergistically with chemotherapy. It provides the exact protocol that was used to help put my husband into progression-free symptom status. It includes the case report, resources, charts, graphs, and other ways to fight cancer. Well, that's a wrap. If you like what you heard and you want to hear more, please subscribe. And if you're new here, welcome. I'm so grateful for all of you, and I'm so glad you are along on this journey with me. We are not alone because we have each other. Next on the ToeTalks podcast, the documentary Vaxxed 3, Authorized to Kill. If you haven't seen it, go watch it. We're going to discuss it next time. Live free, pursue health, and breathe deep. Until next time, everyone, this is Dr. Toe signing off. Important disclaimer. This podcast is presented solely for educational and entertainment purposes. I am not a medical doctor and I do not diagnose, advise, or treat. This podcast is not intended for the substitute of advice from a personal physician, professional coach, psychotherapist, or other qualified professional. It is not intended to be used or relied upon for any diagnostic or treatment purposes, or to be used as a substitute for professional diagnosis, treatment, or conventional medical therapy. None of the statements made in this podcast have been evaluated by the Food and Drug Administration. Please consult your healthcare provider before making any healthcare decisions or for guidance about specific medical conditions. Listen responsibly.